Its spread seems unstoppable. The Omicron variant of coronavirus has driven France to report Europe's highest ever daily number of COVID-19 cases, over 330,000 on Wednesday. In the countries where it is the most prevalent, never-before-seen numbers of workers are either off sick or in self-isolation. Omicron is testing public services to their limits.
Britain's recent spike in Omicron cases is making it harder for ambulance teams to find available hospital beds for COVID-19 patients. The healthcare system is reaching its limits.
Previous waves of the pandemic didn't have a single day with more than 100,000 new cases reported. One day last week, we had 200,000 people test positive. And the latest figure today is another 218,000, though with that includes some delayed reports. So anyone who thinks our battle with COVID is over, I'm afraid, is profoundly wrong.
Boris Johnson wants to keep schools open with testing and other preventative measures. The aim is to avoid another lockdown. But there's still a threat of critical infrastructure collapsing, such as police, fire departments, waterworks, and transportation. Some schools in the U.S. have already shut their doors. This week, daily coronavirus cases surged above the million mark for the first time. President Joe Biden has repeatedly urged Americans to reduce their contacts to slow the spread of the virus.
And we're seeing COVID-19 cases among vaccinated in workplaces across America, including here at the White House. But if you're vaccinated and boosted, you are highly protected. You know, be concerned about Omicron, but don't be alarmed. But if you're unvaccinated, you have some reason to be alarmed. Many of you will, you'll experience severe illness.
There are also fears that if too many people become ill in the U.S., staff shortages could affect power stations, police, and rescue services. Supplies of medicine and food could also be severely disrupted by a lack of healthy workers.
Well, we can now speak to Tom Brooks, who is a professor of law and government at the University of Durham in the UK. Thanks for joining us on DW Business. We're seeing extremely high numbers of people, either ill or isolating because of Omicron in the UK and France. I mean, what sort of knock-on effect is that having for businesses and for critical services?
It'll have quite a lot. I mean, one issue will be the workforce. Many people will be, as you noted, be ill or be isolating. It causes other problems as well in terms of the unpredictability of the future. Will governments be making different restrictions or not? Very often in the UK, it's been on very short notice, next day, next 48 hours. So that unpredictability isn't very helpful for business as well. And then finally, kind of bringing those two things together, getting labor from abroad has been more difficult with the different restrictions between countries, and of course with Britain's Brexit has kind of made this kind of very difficult cocktail at a very worrying time.
And you mentioned the problem of the unpredictability of things for businesses. Is there anything that governments could be doing to be better prepared for this sort of situation?
Well, I think, predicting the particular variant that will come along in future, if any, and what it will do, that's obviously something they probably can't predict with much accuracy. But one thing they might be able to do is kind of have maybe more clear tests or more clear guidance as to when they might make certain moves, rather than leaving businesses to kind of guess whether very high rates one day is going to lead to restrictions next week. You have a variety of kind of mixed messages from the government telling people to work from home, but please visit your restaurants and bars and elsewhere. And I think this unpredictability, confusion, mixed messages isn't helping defeat the virus, and it's certainly not helping the economy.
Yeah, we've seen in the UK, and it's also being considered here in Germany, the cutting of isolation times, for example, so that people can get back to work a bit sooner. I mean, how would you rate how countries are reacting to this, just briefly, if you can?
Yes, well, I think that some of these moves have been good, understandable as more of the population has been vaccinated and boosted. I think the one issue is how it's being done in terms of communicating to the public. A few months ago, a year ago, being told there's 7-10 days that someone needs to isolate certain tests to be done, PCR tests in the UK. But now we're told we don't need PCR tests. Now we're told that a shorter period of time is better for everyone, vaccinated or not. And I think, again, a bit more clarity on the communication would go a long way.
Public messaging, very important. OK, Tom Brooks, thank you very much for joining us.
A pleasure. Thank you.